Hello and welcome to NHIS in a week where we give you the highlights in the authority and the scheme. My name is Shanice Palm. Now to the headlines. NHIA CEO honored for leadership and reforms. 37 military hospital commends NHIA. And NHIA mourns with DCE for finance and investments. To our first story, the Chief Executive of the National Health Insurance Authority, Dr. Victor Asari Bampo, has been honored for his leadership and reform agenda. The recognition was conferred at the Ashanti Regional Communications Bureau's end-of-year communication retreat held in Kumasi.
Dr. Victor Asari Bampo was recognized at the retreat in Kumasi for his contributions to strengthening the National Health Insurance Scheme. The event brought together senior officials of the National Democratic Congress, communication professionals, and public sector leaders, including the Ministry for Foreign Affairs, Honorable Samuel Okujeto Ablakwa, and the CEO of COCOBOD, Dr. Randy Abbey. The NHIS CEO, who was not present, was represented by the head of communication, Faustina Derry, who received the award on his behalf. She described the recognition as an endorsement of the ongoing reforms at the authority, highlighting timely claims payment and the intensified fight against illegal co-payments. She noted that these measures are restoring public confidence in the scheme and assured that further reforms would be rolled out in 2026 to improve efficiency, strengthen accountability, and ensure sustainability of the NHIS.
Moving on, management of the 37 military hospital has commended the National Health Insurance Authority for significant improvements in claims processing. The praise followed a courtesy visit by the hospital's management team to the NHIA head office in Accra.
Speaking during the visit, the acting Deputy Chief of Staff, Medical and Commander of the hospital, Brigadier General Evelyn Vivian Abraham Kwabia, said the hospital currently has no outstanding claims payments. Responding, NHIA Chief Executive Dr. Victor Asari Bampo attributed the improvement to leadership, government support, and reforms within the health insurance system, including the uncapping of the National Health Insurance Fund, which brought in an additional 3.4 billion cedis in 2025.
It's more importantly due to the leadership and vision that we are getting now, and the fact that the National Health Insurance Fund has been uncapped. So there was that cap which was removed, and last year it made us get about 3.4 billion cedis more. And so if we ask the finance minister, he will tell you that he's not doing anything different. He's just being more disciplined.
He disclosed that by the end of 2025, NHI's active membership had reached 22.3 million, representing 66% of the population.
The government is doing a fantastic job of giving us the funding. They are doing a fantastic job of making sure we pay monthly. And there's increasing confidence. So for the first time in history, we had at the end of last year 22.3 million people who had actually registered. So 66% coverage. It's never happened before.
Management reaffirmed its commitment to timely reimbursements, noting that claims are sometimes paid up to 3 times within a month. The visit reaffirmed the growing collaboration between the NHIA and healthcare providers to improve service delivery for NHIA cardholders.
Moving to the north, staff of the authority joined the Deputy Chief Executive for Finance and Investment, Madam Anna Anisaid Bugbri, to mourn the passing of her mother. A delegation of the authority attended the funeral rites in Navrongo.
We are going, heaven knows where we are going, but we know with you, and we will get there. Heaven knows where we will get there, but we know we will.
The delegation was led by the Deputy Chief Executive for Human Resource and Administration, Mr. Raphael Sekpep, and included directors, deputy directors, regional directors, PAW representatives, and staff from across the country. On behalf of the board, management, and staff of the NHIA, the delegation presented assorted drinks, bottled water, and a cash donation to the bereaved family and conveyed heartfelt condolences.
The Private Health Insurance Scheme Directorate of the NHIA has held a strategic retreat to reposition the Directorate for effective delivery in 2026. The retreat focused on reviewing challenges from 2025 and strengthening regulatory effectiveness.
The 5-day retreat brought together management and staff of the Directorate under the theme Strengthening Regulatory Effectiveness, Harmonization, and Strategic Alignment. It aimed at reviewing the 2025 program of work and aligning strategies for 2026. Addressing participants, the Deputy Chief Executive in charge of Human Resource and Administration, Mr. Raphael Sekpep, urged staff to refocus and deliver on their mandate, assuring them of management's full support.
Last year was a transition year, but this year we have no excuses if we do not plug the gaps. And so we expect that, or as it is, this kind of retreat will afford you the opportunity to collectively reflect and re-strategize, take stock of the past year, and then craft a new path for the coming year. And so, from us as executive management, we're very proud of what you're doing, and I think this will be emulated by all the other directorates under my division.
Presentations at the retreat highlighted achievements, challenges, and priority actions for 2026, including the review of private health insurance guidelines to improve regulatory clarity, compliance, and operational efficiency.
The National Health Insurance Authority has held a cervical cancer awareness health talk as part of activities marking Cervical Cancer Awareness Month. The program focused on prevention, screening, early detection, and NHIS support for treatment.
The event, organized by the marketing team of the Corporate Affairs Directorate, took place on January 16, 2026 at the Ministry of Health Conference Room in Accra. Participants were educated on screening methods, including visual inspection with acetic acid, pap smear, and HPV testing. It was disclosed that between 2023 and 2025, the NHIA processed over 5.7 million Ghana cedis in claims for cervical cancer treatment for more than 5,600 NHIS members.
Between the year 2023 and now, 2025, we've had about 5,649 claims for either chemotherapy, radiotherapy, or consultation. And the amount involved in this is 5,743,358 Ghana cedis and 69 pesos. So, Antidoris, people are really assessing the service within their NHIS, and I believe this is something we are committed to and more.
Panelists cautioned against unsafe practices and unapproved herbal medications, while management reaffirmed NHI's commitment to health education, prevention, and access to quality health care.
Now to our final story. The Professionals and Allied Workers Union of the NHIA has held its first quadrennial Delegates Congress in Kumasi. The conference ended with a call for unity and stronger advocacy for workers' welfare.
Held at the CCB Auditorium at KNUST, the 3-day Congress brought together delegates and stakeholders under the theme, Stronger Together, Empowering Workers' Rights and Welfare. Union leaders highlighted achievements including retirement seminars, women empowerment programs, land acquisition for a hostel and conference hall, and improved welfare initiative for members. Elections held at the Congress saw Brother Yakubu Hamza retain his position as national chairman. The newly elected executives were sworn in, marking a renewed commitment to collaboration between the union and NHIA management.
Jimmy Ruffle, I don't understand. I hope you've been taking your medication. Ajo better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and I would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith, eh? Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the power of ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
That's all that we have for you in this week's edition of NHIS in a Week. For more stories, do visit our website www.nhis.gov.gh or visit our various social media handles displayed on the screen. My name is Shani Spam. Do have a lovely week.